this is a stressful time with so many unknowns about COVID-19. To help, we asked for your questions. Tonight, I FaceTimed with a doctor at Mercy Hospital to get some answers. To begin, I asked how he and his colleagues are doing.
We're doing well. We've got a lot of time to prepare. We're starting to see a slight increase in cases, which is a little bit nerve-wracking, but we're prepared. We know it's coming, and we're as current as we can on all the medical information out there, and we're going to provide the best care we can to our communities.
What about the governor's stay-at-home order? Can you just, from your perspective, talk about how that will help someone in your position and your colleagues as well?
We're fully supportive of that order. You know, the governor's stay-at-home order is really intended to slow the spread of the disease throughout Minnesota. We want to make sure that we have the capacity to take care of the patients that come to us, and the best way we can have that capacity is to slow the spread. So when patients do get sick, we have emergency rooms that are open, we have hospital beds that are open, and we have intensive care units that are open if patients need that level of care.
The president now saying that some of these orders will be in place through the month of April, and some of ours in Minnesota would expire on April 10th. But is there a timeline in your mind that you feel like we can perhaps breathe a little bit easier, or is it really just day to day and wait and see?
I think it's going to end up being a week by week, most likely. I think we're going to need to follow patient censuses throughout all of our hospitals, and again, make sure we continue to have the capacity. The hard part about this disease is that it spreads very easily. However, we don't see the symptoms for up to 12 to 14 days after. So when these orders go into effect and people stay at home, we are actually going to see these impacts on our patient volumes for 2 weeks later.
Some of our viewers are wondering about the PPE shortage. Is that a concern?
Currently, we do have the personal protective equipment that we need at Allina, but we do share the concerns that every health system is facing across the country. Almost overnight, the demands for the personal protective equipment have gone up, and unfortunately, the manufacturers are just unable to keep up with that sort of demand. So we are doing everything we can to preserve the life of our PPE.
How long is the average patient staying in the ICU?
Like any illness, intensive care unit stays can be very variable. However, with COVID-19, we are seeing people on ventilators for 7, 12, 14 days and even longer. And that's really unique about this disease, just how long, when people get critically ill, how long they need the ventilatory support.
And I'm sure you've probably seen this out there now, this Ibuprofen debate that seems to be floating around online. Some people saying that Advil could make symptoms actually worse when it comes to COVID-19. Have you been talking about that in the hospital? Is there any truth to that?
Well, that is currently being studied. It definitely has not been supported in the literature, but we do recommend typically for treating a fever or for any aches or pains to start with Tylenol, but the ibuprofen debate has not been fully defined yet in studies.
Stacy Nelson is wondering about allergy season, since that is happening now. She's constantly using her inhaler, she says. Should she only worry if she has a fever along with the coughing and shortness of breath for her symptoms?
Well, typically with COVID, we do see a fever and we do see a productive cough. However, if she is using her inhaler more than normal, I would recommend that she discuss this with her primary care provider to make sure that nothing is going wrong that we should be aware of.
I really love this one. Kelly Hetwer-Olson, she says, what can the general public do to be helpful to you? That's what she wants to know.
The most helpful thing would be to follow the governor's orders, to stay home, always socially distance when you're out shopping, wash your hands with warm soapy water. And if you want to support caregivers at Allina Health, we do have on the allinahealth.org website a Caring for Caregivers donation that people can support us through that.
Colleen Dorsey wants to know about testing. How are you feeling about testing at this point? Are you able to test more people?
Well, we still have limited testing in Minnesota, largely across the nation. We are still really limited in testing to those patients that need to be admitted to the hospital and also to caregivers that may have been exposed. We have seen an improvement in turnaround times in testing. We have seen some tests come back as soon as 24 hours. We still, however, do see some tests that take up to 6 days. I am optimistic that in the next couple of weeks, as more labs become available, that we'll have more rapid turnaround times, but that's where we're at today.
Dave is wondering about the risk, when he goes to Target or the grocery store.
Yeah, risks unfortunately do exist in the community, and that's why the social distancing is so important. And I just want to remind people that the most important thing they can do is to stay home. socially distance when they're out, keep their hands clean, and just recognize this is going to be a long epidemic that most people have never seen, including myself. So we are going to need patience through all of this, and we are going to need to tackle this together because it's such a challenging thing for our communities and for our nation.
And keep your questions coming. We're always trying to answer them. You can send any questions to the email address you see right there on your screen, tips@wcco.com.